you don't really think about yourself. You just think about the person that you love and want to feel better and that you don't want to suffer anymore. My dad is really funny. He has a huge heart. Best dad ever, like very involved, loves his kids. He was sick from a pretty young age. In the mornings, he would get really like nauseous and start throwing up, and the doctors could never like really figure out what it is. He had chronic kidney disease. Suddenly in July of 2020, they were completely done. He had to start emergency dialysis. I started the process, or I tried to donate my kidney then, because every day he went to dialysis was dreadful. You don't think about a lot of things when you're going through the process. You're just kind of like tunnel vision, like, hey, I needed my dad to get better. And then when it happened, I was like, wow, okay, I'm gonna have to go through surgery.
The STAR-N program is our new grad onboarding. It's a great transition from professional student to a professional nurse. And so it's a mixture of didactic, classroom-style learning, and then there's also a lot of hands-on. And so you go from trying to pass the test and get your NCLEX done and become a licensed nurse to, okay, these are the skills that are necessary for me to perform and function to the best of my ability and really deliver the best care.
It wasn't until her last day of didactic training I got a call from Rikki and her nurse residency coordinator, her instructor, telling me that they had something really important to talk to me about. And I could tell it was very serious. And she stopped and said she's a match for a kidney for her father, who's been very sick for a very long time. It was at that point she said she's gonna need an extended leave of absence to go through the process. And 100% absolutely whatever she needs.
Like, I was really nervous about it, if I would still have a job at the end of this. And I was also thinking like, okay, I guess I'll have to start over somewhere else if they're not allowed to accommodate my needs at like when it's time.
It was clear to me, like I didn't need to ask anybody else. Like it was just like, this is how we operate here. Patients first, employees first, always. And so whatever she needed, I knew that we had a full team here to support her.
What in the world? Hi, my baby girl. Dad's right there.
I really understand the importance of what a living donor can really do for a patient. Being able to provide her that opportunity just as a support to ensure that she had stability and a job when she returned to go and take care of her father. It's the least that we could potentially do in that situation.
I felt so relieved after I can like breathe. I was like, okay, everything's like going as planned. Like, this is amazing.
Care Like Family is how we show up every day. We treat our patients, our visitors, our colleagues, our community, our hospital. Everything we do is Care Like Family, and that's just instilled in us and truly how we show up in this facility.
We're not just employees, we're family, and honestly that's what it feels like on the floor. Having that family that understand what you're going through like meant a lot to me.
She is compassionate. She's also passionate about being a nurse and about patients. And she's now back at work, and she's been back now for at least a month, if not a little longer, and just, I mean, seamless transition. She shows up every day, the nurse that you want caring for you if you're a patient here. She's gonna impact a lot of lives.